Welcome to NCLEX PN exam practice test. Our topic today is cardiovascular. Use the link in the description to download the app on the App Store for more courses and free practice tests. Number 1. Because the client continues to have an irregular heart rate, the physician schedules the insertion of an artificial pacemaker. As part of the discharge instructions, the nurse correctly instructs the client that which symptom is a sign of artificial pacemaker malfunction. A. Tingling in the chest area. B. Dizziness during activity. C. Pain radiating to the arm. D. Tenderness beneath the skin. The correct answer is B. Dizziness during activity. Explanation. If the artificial pacemaker does not support a heart rate high enough to maintain adequate cardiac output, the client feels dizzy and possibly faints. Tingling in the chest is unrelated to the artificial pacemaker. Pain that radiates to the arm is a symptom of angina pectoris or myocardial infarction. Tenderness may be caused by an infection. Number 2. A client with CAD experiences periodic chest pain and is diagnosed with angina pectoris. If the client is typical of others who have angina pectoris, the nurse would expect the client to report that chest pain is best relieved by which non-pharmacological measure? A. Taking a deep breath. B. Resting in a chair. C. Applying heat to the chest. D. Rubbing the chest. The correct answer is B. Resting in a chair. Explanation. Angina, or chest pain, is caused by an inadequate supply of oxygenated blood to the myocardium due to narrowed coronary arteries. Rest generally relieves angina. Once the myocardium's demand for additional oxygen is reduced through inactivity or rest, the chest pain is relieved. Taking a deep breath and applying heat to the chest or rubbing the chest will not alleviate the pain of angina pectoris. One main difference between stable angina pectoris and a myocardial infarction is that rest relieves the chest pain associated with stable angina. Number 3. The nursing team establishes the nursing diagnosis: decreased cardiac output related to tachycardia, decreased stroke volume, and increased vascular volume, and enters this into the client's care plan. The team also includes the following goal: the client will have an improvement in cardiac output by discharge. How can the nurse best measure whether the client has achieved the goal? A. The client will have vital signs within normal parameters. B. The client will lose no more than 5 pounds per day. C. The client will have decreased peripheral edema. D. The client will have a 24-hour urine output of 1,000 milliliter. The correct answer is A. The client will have vital signs within normal parameters. Explanation. For the client who exhibits signs and symptoms of heart failure, the main goals include decreasing the heart's workload, improving circulation, and managing fluid retention. The identified goal of improved cardiac output can be measured by assessing the stability of vital signs. Rapid weight loss of 5 pounds per day is too much and is inappropriate for this goal. Having a decrease in peripheral edema is too subjective and not easily measured. A 24-hour urine output of 1,000 milliliter is inadequate. An adequate urine output should be about 2,000 milliliter per day. Number 4. The physician orders digoxin, lanoxin. After the digitalizing loading doses have achieved their therapeutic effect, the physician prescribes a daily maintenance dosage of 0.125 mg of digoxin PO. If the client develops digoxin toxicity, what would the nurse expect the client to exhibit? A. Anorexia and nausea. B. Dizziness and insomnia. C. Pinpoint pupils and double vision. D. Ringing in the ears and itchy skin. The correct answer is A. Anorexia and nausea. Explanation. GI symptoms associated with digoxin, lanoxin, toxicity include anorexia, nausea, vomiting, and diarrhea. The client may also become drowsy and confused or have visual changes, such as blurred vision, disturbance in seeing yellow and green colors, and a halo effect around dark objects. Toxic doses of digoxin can also increase cardiac automaticity, causing a rapid heart rate, or depress the conduction of cardiac impulses, causing a slow heart rate. Serum drug levels are used to monitor the client's metabolism of digoxin. Pinpoint pupils are associated with opiate toxicity. Double vision is associated with myasthenia gravis. Ringing in the ears is a symptom of salicylate toxicity. Itching is a common side effect of many drugs, but it is not related to digoxin toxicity. Number 5. While the client takes propranolol, Indrel, what changes would the nurse expect to see in the client's pulse rate? A. Faster than usual. B. Stronger than before. C. Temporarily irregular. D. Slower than in the past. The correct answer is D. Slower than in the past. Explanation. Beta-adrenergic blockers such as propranolol, Indrel, interfere with the action of epinephrine. They reduce heart rate. Therefore, the pulse rate tends to be slower than in the non-medicated period. Some clients develop bradycardia while taking the drug. Propranolol does not produce a stronger heartbeat or irregular heart rhythms. Number 6. Dietary management of the client with congestive heart failure includes the restriction of A. Sodium, B. Calcium, C. Potassium, D. Magnesium. The correct answer is A. Sodium. Explanation. Dietary management of the client with congestive heart failure includes a sodium-restricted diet. Answers B, C and D are incorrect because they are not restricted in the client with congestive heart failure. Number 7. A 50-year-old client is scheduled for a heart transplant tomorrow. The night nurse is asked to review the surgical procedure with the client. Because of the client's anxiety, the client has difficulty comprehending the nurse's information. During the postoperative period, what is the best rationale for the nurse frequently assessing the client's fluid status? A. Urine retention is common after a heart transplant. B. Urine output is an indication of perfusion to the kidneys. C. Hydration determines when the client needs to be transfused. D. Hydration indicates when fluids should be increased. The correct answer is B. Urine output is an indication of perfusion to the kidneys. Explanation. Because the client has had a heart transplant, assessing urine output is a good indicator of the heart's ability to pump and perfuse the kidneys. Monitoring intake and output also helps the nurse determine whether the client has a fluid volume overload or deficit. Usually, recipients who undergo heart transplantation are fluid restricted until their condition stabilizes, therefore, fluids are monitored. Hemoglobin values and hematocrit are used to help determine when the client needs transfusions. Urine retention is not common unless several doses of opiate drugs are given for pain. Number 8. The nurse explains to the client that nitroglycerin tablets lose their potency if exposed to light and air. The nurse knows that the client understands how to determine when the nitroglycerin tablets need replacing when the client makes which statement. A. The tablets will smell like vinegar. B. The tablets will be discolored. C. They won't tingle in my mouth. D. They will disintegrate when I touch them. The correct answer is C. They won't tingle in my mouth. Explanation. The client should experience a fizzing or tingling in the mouth if nitroglycerin tablets are still fresh. Another possibility of lost tablet potency is a failure to experience relief of chest pain, similar to that experienced when the prescription was originally filled. If potent, chest pain should be reduced or relieved in 1 to 5 minutes after administering a tablet. To ensure that tablets remain potent, they should be stored in a cool location, tightly capped to avoid moisture, and replaced every 3 months. They do not discolor or disintegrate when they have lost their potency. Old aspirin tablets, not nitroglycerin tablets, tend to smell like vinegar. Number 9. A 65-year-old client collapses in the hospital elevator while coming to visit a family member. A nurse goes to the victim's aid. Which is the best method for determining if the victim requires rescue breathing? A. Observe the victim's skin color. B. Feel for pulsations at the neck. C. Check for absence of normal breathing. D. Blow air into the victim's mouth. The correct answer is C. Check for absence of normal breathing. Explanation. Once the airway is open, some victims begin breathing spontaneously. The nurse briefly assesses for spontaneous breathing, no breathing, or absence of normal breathing, such as gasping for air. Leaning over the victim's head and listening or observing the chest rise and fall should be done as quickly as possible. Skin color is not a dependable indicator of breathing because hypotension is likely to cause the victim to appear pale or ashen. The nurse would check the carotid pulse to determine the need for chest compressions, not rescue breathing. Administering rescue breathing is unnecessary if the victim is spontaneously breathing. Number 10. Which of the following dysrhythmias is most likely to occur during suctioning? A. Bradycardia. B. Tachycardia. C. Ventricular ectopic beats. D. Sick sinus syndrome. The correct answer is A. Bradycardia. Explanation. Excessive vagal stimulation causes bradycardia because of parasympathetic stimulation. Answers B, C and D are not arrhythmias associated with suctioning, so they are incorrect. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.